If your child with autism struggles with fatigue, brain fog, and developmental regression after illness, or difficulty keeping up with therapies, you might be looking at something most doctors never mention: mitochondrial dysfunction. I'm Olga Afichuk, and I work with healthcare providers and families every day to translate pharmaceutical science into real-world understanding. In this video, we're going to explore one of the most fascinating and surprisingly hopeful areas of autism research: how the tiny energy factories inside your cells, the mitochondria, can directly influence brain development and behavior. By the end of this video, you'll understand what mitochondrial dysfunction looks like in autism and what testing and treatments exist, as well as why supporting cellular energy may hold the key to better focus, language, and resilience. What are mitochondria really? You can think of mitochondria as the batteries inside every cell of your body. Their job is to convert nutrients like glucose, amino acids, and fats into ATP, the molecule that powers almost everything your cells do. Even though it makes up only 2% of body weight, it uses roughly 20% of all energy produced. That means that even small mitochondrial problems can have big effects on thinking, speech, learning, and behavior. In simple terms, when your child's brain cells can't make enough energy, neurons can't communicate efficiently. Messages slow down, development stalls, and the brain works harder just to do basic tasks. So, how does this connect to autism? Research over the past 15 years has consistently shown that children with autism are much more likely to have measurable abnormalities in mitochondrial function, especially in muscle, liver, and brain tissues. Some estimates suggest up to 30 to 50% of children on the spectrum show at least mild mitochondrial dysfunction when tested. Here's what that looks like in real life: regression after infections or high fevers, severe fatigue or crashes after activity, poor temperature regulation, low muscle tone, and development plateaus or sudden skill loss. That regression after illness, that's not behavioral backsliding. It's the mitochondria struggling to keep up with the energy demand of recovery. Neurons are some of the most energy-hungry cells in the body. They rely on mitochondria, not just to function, but to grow, prune, and form connections, the literal wiring of learning. When mitochondria underperform, a few things can happen: reduced neuronal firing speed, which means that signals between the brain regions slow down. 2, oxidative stress. Damaged mitochondria leak free radicals, which can inflame and irritate brain tissue. 3, impaired neurotransmitter balance. Serotonin, dopamine, and GABA levels can all be affected. And 4, lowered detox capacity, making it harder for the brain to clear inflammatory byproducts. The result is cognitive fog, speech delays, irritability, and sensory overload, all of which can overlap with autism symptoms. This doesn't mean that mitochondrial issues cause autism, but for a large subset of children, they clearly contribute to its expression. Several factors can disrupt mitochondrial health, especially in genetically sensitive kids: genetic mutations in mitochondrial or nuclear DNA, environmental stressors like toxins or chronic infections, inflammation that damages mitochondrial membranes, nutrient deficiencies, especially carnitine, riboflavin, CoQ10, and iron, and oxidative stress from poor antioxidant capacity. In autism research, one of the most interesting findings is that mitochondrial and folate issues often coexist. When folate can't enter the brain efficiently, mitochondrial enzymes lack crucial methyl donors, which can also worsen energy deficits. So folate metabolism, what we discussed in the last video, and mitochondrial energy are two sides of the same coin. How to test for mitochondrial function. There isn't one single test for mitochondrial dysfunction, but here's what many integrative providers and specialists use as a starting point: serum carnitine, total and free. Low levels are common in mitochondrial issues. Lactate and pyruvate ratios. These rise when cells switch to less efficient energy production. Organic acids test, OAT, looks at byproducts of mitochondrial metabolism. Creatine kinase, CK, can rise after mitochondrial stress, and acetylcarnitine profile, a detailed look into how the body is metabolizing fats for energy. No single result makes the diagnosis. It's about identifying patterns that show the mitochondria are struggling. Let's talk about what can actually help. Nutrient depletion. Mitochondria rely on several key nutrients to produce ATP. The most studied include L-carnitine, which helps shuttle fatty acids into mitochondria for fuel, coenzyme Q10, also known as ubiquinol or ubiquinone, acts as the main electron carrier in energy production, riboflavin, vitamin B2, required for multiple mitochondrial enzymes, alpha-lipoic acid, both an antioxidant and a cofactor in energy metabolism, and magnesium, which is essential for ATP stability and enzyme function. Many of these are available as oral supplements, and some, like carnitine, can be compounded into liquid or injectable forms for children who need customized dosing. Antioxidant support. When mitochondria are under stress, they release free radicals that damage cells. Antioxidants help neutralize that damage. Some options used under medical supervision include N-acetylcysteine, NAC, boosts glutathione, the body's master antioxidant. Vitamins C and E support detoxification and protect lipid membranes. Glutathione can be taken orally, transdermally, or via IV therapy as well. Mitochondrial upregulators. This is where newer research gets exciting. Certain compounds actually enhance mitochondrial efficiency or biogenesis, meaning they help create new mitochondria. These include NAD+ and their precursors, essential for mitochondrial DNA repair and energy transfer. PQQ stimulates mitochondrial growth and protects existing ones from damage. Methylene blue, the same pharmaceutical compound used for decades in medicine, now being studied for its ability to improve mitochondrial function and brain energy metabolism. And yes, we offer it both orally and intravenously for supervised use through our pharmacy. Lifestyle and environmental optimization. Because mitochondria respond directly to stress and toxins, small environmental tweaks make a real difference. Prioritize quality sleep. Mitochondrial repair happens at night. Maintain stable blood sugar with balanced meals. Limit unnecessary medications that deplete nutrients. Reduce exposure to environmental toxins and heavy metals. These adjustments may sound simple, but for a child whose cellular energy is fragile, they can be powerful. When mitochondrial function starts improving, the changes are often subtle at first. Patients report longer attention spans, more consistent energy, fewer meltdowns after exertion, faster recovery after illness, and gradual improvements in speech and engagement. These small shifts are signs that the brain is finally getting the energy it needs to do the hard work of growing and connecting. Mitochondrial support is generally safe, but dosing matters, especially for children. High doses of certain nutrients can backfire or interact with medications. That's why it's crucial to work with a provider familiar with biomedical or functional autism care. Someone who can test, track, and adjust your child's regimen based on real data. This is also where compounding pharmacies play such an important role. They allow for precise, customized formulations, liquid, capsules, injectables to be built around your child's exact needs. Autism is complex, but it's not hopeless. Every new discovery, whether it's about folate, methylation, or mitochondrial function, moves us closer to understanding that biology and behavior are intertwined. When we treat the body with the same attention we give the mind, children thrive in ways that traditional medicine once thought impossible. The folate pathway gives the brain the tools to function. Mitochondria give it the power to run, and both can be supported with science, care, and a little bit of hope. If you found this helpful, subscribe and stay tuned. I'll be covering more about how mitochondrial health ties into mood, attention, and even adult fatigue. There's so much more to uncover about how these tiny organelles shape big human experiences.